Hello, good day to you. My name is Jessica Lee and I am the International Youth Conference Director. Today our session is on promoting inclusivity and accessibility in community healthcare for enhanced health and well-being. Joining the session, we have Ms. Ramirez Williams, who is an experienced nonprofit strategist with more than 20 years of experience providing consulting to emerging and startup nonprofit organizations throughout the U.S. and to NGOs globally. She also specializes in nonprofit and NGO sustainability, financial management, investment, and more. Her humanitarian works include being the director of the UN Way of USA, delegate to the UN for Human Rights for Girls and Women. She also advocates for global health education and eliminating health disparities, especially in the areas of sickle cell disease. And next we have Dr. David O'Rourke, who has years of experience working in infection control and prevention, health insurance, and general medicine practice. And he's also one of the trustees of Villa Sickle Cell Foundation Nigeria. He's also the executive member of Amplify Sickle Cell Voices International Inc., which is a global sickle cell organization. He's also a writer, and he has won many awards while serving in the editorial crew of some organizations, including the 2003 Best School UITH Chapter Editor-in-Chief of the Nigerian Conference of Christian Medical and Dental Students, NCCMDS. Dr. David is Christian, married, and has two awesome boys. Thank you so much for joining us, Ms. Lenore Williams and Dr. David O'Rourke. And now I would like to turn the floor to Ms. Lenore Williams.
Thank you, Jessica. I appreciate that.
Thank you.
And thank you for allowing us to speak today.
Yes, thank you.
I wanted to say welcome to everyone. I just wanted to take an opportunity, both Dr. David and I would like to take an opportunity to give you some more education on what is sickle cell disease and what is the actual disease and what are we talking about, what's the history behind it, and why we're even here, who has the disease, who can have access to health care, and all of those things will be in our presentation. Before we get started though, I would like to take an opportunity to show you, both David and I, Dr. David and I would like to show you. Sometimes we can talk a lot about something, but it's nice if you could visualize it and actually see some of the people that have been with the disease for a long period of time. To give you an example of what cultures are really impacted by sickle cell disease. So at this time, we'd like to take a moment to put on those videos for you.
It can rob you of your confidence, your self-confidence. Throughout my childhood, pain has been the biggest factor. It's been really. It can rob you of your confidence, your self-confidence. Throughout my childhood, pain has been the biggest factor. It's been really bad, and obviously I had to go into hospital with crisis. A crisis is a prolonged period of pain. If it's gone on for a very long time, that's when I'd need to go into the hospital and get treated. I was initially admitted and I was in the hospital for a week. I was discharged. The pain wasn't really controlled and I had to come again for another few days. Now, that would be the worst. Aside from the pain, it's just the tiredness. I always feel fatigued in school, like staying concentrated in lessons, engaging with conversations with my friends. It's become a huge challenge for me. Last year, I was doing a really important exam that would possibly determine what I'd be doing for the rest of my life. That was a very stressful time. I was ill for quite a lot of it actually, and I just had to keep on going. It took a lot of mental strength to really get through that period. And I think I'm proud of myself for that. Mental and emotional factors contribute to the physical sides of things. If I get stressed, it can bring about a crisis. One of the things with living with sickle cell is understanding your own pace and really coming to understand that you can't always compare yourself to other people. You have to really understand your health and who you are as a person. So it has almost held me back from doing some things that I wanted to do. Being a teenager in general, I think, is a bit difficult, but with sickle cell, it comes with its own challenges. I mean, you want to go out, you want to stay out as long as your friends, but there's other things to think about as well with sickle cell. Even before you leave the house, you have to think about what the weather's going to be like, how many layers I have to wear, drinking, but I don't let that really stop me from going out and having a good time. For the teenagers living with sickle cell and the young people, don't let sickle cell hold you back from your dreams or aspirations, because you can achieve anything you want to achieve, as corny as it sounds. Just don't give up. You can do it. It will be difficult, but you can do it.
I think that's pretty typical. Nothing happens until you have to do something, and then your voice all of a sudden goes hoarse. So please forgive the hoarseness in my voice, and we'll continue. We had another video, but we'll bring it back as soon as we're able to receive it. I wanted to talk to you as an advocate. I am an advocate of sickle cell disease. I initially discovered sickle cell disease at an event and really became really challenged by the fact that I didn't know enough about this disease and how many people it was impacting in the world. And I've taken a position since then to advocate for not just access, but for a cure as well. So allow me to at least tell you a little bit about this disease, the basics, and then I'm going to have Dr. David, who is not just a medical physician, but is a warrior. What we call warriors are people who have the disease and have had the disease from childhood on and are actively working every day through through the sickle cell disease itself. So he's a warrior, he's an advocate, and he's a writer. But he'll take over from me. Right now, I just want to give you a brief overview. I want to tell you about some of the foundations that exist for sickle cell. In addition to my foundation, and I am a foundation about humanity and health access. But in addition to my own foundation, there's a coalition. It's called the Sickle Cell Disease Coalition. That's slide 4. The Sickle Cell Disease Coalition has been around since 2016. And it was started by the American Society of Hematology. It has over 113 members. Its members are not individuals, but it's actually organizations. And those organizations consist of Individuals, consist of public health, research organizations, provider organizations, patient groups, faith-based organizations, federal agencies, industry representatives, and foundations. And the reason why I'm taking the time to tell you that is because this disease is not specific to healthcare, but it's across the board, that we have to approach it from all angles. And this particular coalition attempts to do that. For example, the biggest parts that this coalition tackles is five parts. One is access to care. How do we get access to care for every person that has sickle cell disease? That is the coalition's journey. Second is blood donors. Believe it or not, sickle cell disease patients need blood transfers and donations. And so we really spend time with getting people to donate blood. Three, global issues. As you will see, we started with the first video in the UK, but then we'll travel around the world and I'll talk about that as well. How many people actually have sickle cell disease in the world globally? And then next is research. Really, it's time to do research and clinical trials to begin to know what is it that we can do that would, one, cure this disease and make it less painful for the individuals, like the young lady talked about. She lives with constant pain. How do we eliminate that? And the fifth issue, which is one of the biggest issues, is sickle cell disease trait. What that means is we have a lot of individuals who are not warriors where they feel the disease every day, but they are carriers of the disease. So those are the five most important areas for the coalition, and I'm happy to say I'm a member of that coalition. You heard about Dr. David. I talked about him, and he will be on NETS. And I told you a little bit about who he is, but I'll let him talk about that more. I just really want to talk about why we call people with sickle cell disease warriors. It's because every day of their life, they're battling pain, they're pushing through just sickness. Some of them may end up with strokes. Some of them will be in the hospital more times than not. Most of them, because their pain is not seen by everybody, they're ignored when they go to emergency rooms. So a warrior is someone who is actually doing the work with the disease and every day making it a new day and living with the pain and access and still being a student, being a doctor, or being whatever they choose to be. I'm going to
Your confidence, your self-confidence.
Okay, the video came back again, but we're going to leave that video. Here's our other video. I think it's a good time to show this video because I think for the most part, people think sickle cell disease is an African American or Black or African disease. It is not. And so this video speaks to that a little bit, and I just would like to just have him tell the story so you can be educated a little more on what is sickle cell disease about and who does it actually attack in their lives.
My name is Ahmed Habib. I'm born with sickle cell anemia. My first crisis was when I was 5 years old. Sometimes when sickle cell stays in one area of the body, that can damage the organ. For example, the tissues, the bones. Every time I put my weight on my leg, I feel pain. So I need crutches to help me walk. It's very, very painful. It's like being lit on fire, like a crashing hammer crashing over and over you non-stop. It's very hard to ignore and it's very hard to endure. There is mental burden and emotional pain. So it's difficult to deal with. That will make you depressed and you don't see the bright side of things. I graduated from civil engineering, but I work as an artist. I lived with the pain for a very long time, and the only thing that kept me alive through this horrible pain is art, and I feel it's very, very therapeutic, especially because I have a lot of days at bed, so I have a lot of meditation, a lot of art ideas. I have to create something to help me to stand out in this world. My talent has grown, my disease, to give me the desire to be special, turn the pain into creative ideas and creative things. It's like taking clay and turn it into a beautiful masterpiece. To use it as a tool instead of complaining and doing nothing, you show it through your creativity and art. It gave me peace. Art, it's definitely a treatment for me because it's alleviate my depression. I'm not talking about just pen and a paper, any kind of art, either photography, poetry, singing, any kind of talent that make you special. When I get the pain, I find solace and find comfort in creating something. It makes me feel in control of something. It's like I am the creator of this beautiful land, which is the canvas, and I am the giver of life, and I give it life. So I hope everybody go to his talent and practice and hone it, so he never get depressed.
Okay. I'd like to give you a little bit of education, if I could, on what is sickle cell disease. And according to the Center for Disease Control and Prevention, sickle cell disease is a group of inherited red blood cell disorders. What it means is the blood cells, instead of them being shaped round, as they are in most people, they're not shaped round. They're shaped in a cyclical, similar to what you see on the screen, these red dots. The red dots are not just shown to you just as decoration, but they're actually what cells can look like in a person who has sickle cell disease body. Normally, the red blood cells contain hemoglobin, a protein that carries oxygen. Healthy red blood cells are round, and they move through the small blood vessels to carry oxygen to all parts of the body. In the case of sickle cell, instead of them moving through the body, they get stuck. Sometimes they get stuck to a wall, sometimes they're released, but they're sticky. They're supposed to move and flow easily, but they don't. Sickle cell is commonly found in people whose families come from Africa, South or Central America, especially Panama, the Caribbean islands, the Mediterranean countries such as Turkey, Greece, and Italy. It's even found in India and Saudi Arabia. I'll give you a little bit of history, because I thought this was interesting when I found out about sickle cell disease. It's actually unscientifically, you know what that means? It means that we can't say as scientists that we discovered sickle cell, but it started in 1670. Which, 1670, and then it was only 200 years later, in 1870, that it appeared in African medical literature. And it wasn't really talked about in our traditional medicine until 1904. So we're talking that, like, if we count the years, it's almost 200 plus, 234 years before sickle cell became a disease that we actually said existed in our own terms. Today, in 2023, 350 plus years later, we're still with the same sickle cell disease. We talked about what happens with the blood cells. We talked about the pain that individuals who have the disease have, but we have no cure. And we have very little access for all levels in the community. I want to give you a comparison because this was interesting to me. Now, I want to take polio. Most of us know about polio. Polio is not a hemoglobin disease like sickle cell is. However, polio was discovered 1 year later than sickle cell disease. 1 year, 1905. Today, in 2023, polio is almost eradicated. And both of them attack children. Both diseases attack children. So it's really a question as to why are we still as far away from a cure and healing with sickle cell than we are with polio. No, they're not the same diseases. No, they're from different sources. But still the challenge was the same, and the same number of years have passed. Sickle cell disease is the most common genetic disease in the world. Approximately 250 million people worldwide carry the gene responsible for sickle cell disease. Each year, about 300,000 infants are born with a major hemoglobin disease worldwide. It is estimated that sickle cell disease affects approximately 100,000 Americans. That number sounds small, but really when I go back to compare it to polio, same number. Actually, polio's number was 80,000. Sickle cell disease occurs among about one out of every 365 Black African Americans have sickle cell, either the trait or the disease. Sickle cell disease also occurs among one out of every 16,000 Hispanic Americans. So when you think about what I'm saying, you can hear why it's a problem and why we're even talking about it in terms of health disparities. And I think it's because we all have to become more knowledgeable about this disease overall. What is also interesting about one in every 13 Black or African American babies born have either sickle cell or the sickle cell trait. That's a very small number in comparison when you think about groups, but it has a very large impact. Annually in California, approximately 150 babies are identified with sickle cell disease. 70 infants annually are identified with the sickle cell trait. Just want to go back to the areas where sickle cell exists. If you can look at the map. Okay, so what you will see is sickle cell disease is prevalent in North America, Latin America, Sub-Saharan Africa, Europe, Middle East, North Africa, and India. Due to the migration patterns of people, what has happened is now people with Mediterranean, Middle Eastern, Caucasian, Indian, Hispanic, Native American, and other ancestries, are infected or affected with the disease. So it's no longer stated as a disease that was found in Africa. It is now migrated, so many cultures are impacted with the disease. I wanted to show you just an idea, a map of some of the centers that exist. And this is only a small amount of centers, but this number is probably 3 times as many. And some of these centers are for adult treatment, pediatric treatment, and of course whole life treatment, from baby to adult. I think the National Alliance of Sickle Cell Centers finally decided that it's time to uniform the treatment, create high quality comprehensive care, and standardize it. And so that's why you start to see organizations trying to map out where these centers are, and then try to bring some cohesiveness to the level of care that's given. Next slide. with this slide, I'm going to leave this now. I'm going to leave you because that's the extent of my knowledge as an advocate. But I study every day trying to learn more. But I want to give this over to Dr. David, who again is a medical doctor, a warrior living with the sickle cell disease, an advocate, and has written many books about it. Dr. David, I'm going to turn it over to you.
Okay. Thank you, Linnea Williams. Uh, Hello, everybody. Good afternoon. Where I am is already almost close to good morning. Let me quickly talk about sickle cell disorder or sickle cell disease and to continue from where my co-presenter stopped. Sickle cell, I most of the time like calling it sickle cell disorder. It's a genetic blood disorder, as she has mentioned, a disease of the hemoglobin. That's why it is called an hemoglobinopathy. It is inherited by birth, and so that makes you understand that it's not an infectious disease, neither is it a communicable disease. It's a non-communicable disease, and it is expressed based on the mutation or mutated gene that the child inherits from both parents. This is an autosomal recessive disorder, and the problem is often emanating from the abnormal structure of hemoglobin within the red blood cell. The red blood cell carries hemoglobin, and the affected gene in the production of hemoglobin is what causes sickle cell disorder. Variants of sickle cell disorder, the next slide, variants of sickle cell disorder, because of time. Before I go to the variants, let me just, how can it be detected? The diagnosis of sickle cell is by hemoglobin electrophoresis and high performance liquid chromatography. Now, the variants of sickle cell disorder, there are sickle cell traits, which are my co-presenter has mentioned as AS or AC. Then there's sickle cell disease. It could be SC or SS. These are the worst in terms of the prognosis. I have SS, sickle cell, hemoglobin SS, so I have sickle cell anemia. There is also the beta thalassemia trait plus sickle cell disease. So there could be beta thalassemia coexisting together with sickle cell disease. And then there's also the beta thalassemia disease coexisting with sickle cell disease. And then there are also some other rarer forms like deep Punjab, O-Arab, and many more beyond this, which makes us understand that there's a need for more research to be able to identify the different types or variants of sickle cell disease. The next slide. So the problem with sickle cell disorder is basically with hemoglobin. Hemoglobin can be broken into two parts, He and globin. He is the iron carrying component of hemoglobin, and it is present within the red blood cell. Globin has two chains, the alpha and beta chain. The problem lies with the beta chain, and the problem is with the abnormal positioning of one of the amino acids within the beta chain, which is located in the bone marrows. So let's move on because of time to the next slide. How is sickle cell disorder inherited? Now, that diagram helps us to be able to understand it. So the T is for somebody who has the trait, and then N is for somebody that is normal, while SC is for sickle cell. So for somebody that has a trait married to somebody that has normal hemoglobin, if that was AA, and then somebody that has a trait AS or AC, this is how it forms. You will see that there are 4 children that are shown in the diagram, and 2 have traits and 2 have normal. Now, I want to be very specific about this. It is not 1 in 4 children. It is 25% of each pregnancy. So the probability of you having, if a father that has a trait or mother has a trait, one of the spouse has a trait and another one is normal, marries and then they have children, for each pregnancy, there's a 25% chance that it will be trait. For each pregnancy, there's a 50% chance because you could see that there are 2 traits and there are 2 normal out of the 4 children. So there's a 50% chance that each pregnancy can be trait, and then there is a 50% chance that each pregnancy can be normal. Now, let's move to the right-hand side, which shows trait when they marry. Both spouses have trait. And father has a trait, sickle cell trait, mother has a trait, either as AS or AC. Now, for each pregnancy, you will see for the 4 children, what is represent is 1 out of the probability of 1 in 4 for each pregnancy, not for 4 children. So for each pregnancy, there is a 50% chance that there will be traits if both parents have trait. There is a 25% chance that each pregnancy that could be sickle cell anemia, which is SC, and then there is also a 25% chance that it could be normal for each pregnancy. I have met families whereby you cannot predict chance. Unfortunately, all their 3 children have sickle cell anemia. Both parents have the trait. And you could also have instances of families whereby all the children are normal, none have sickle cell anemia. So that is how it occurs. That is how it is inherited. It is for each pregnancy, not 1 in 4 children. It is for each pregnancy. And because probability or chance cannot be predicted, you could have a family whereby all the children have sickle cell anemia, all the children have trait. And that is why it is important to create proper awareness about it. Let's go to the next slide. Thank you. Okay, so what are the triggers of sickle cell crisis? On the next slide, it talks about the crisis of sickle cell anemia. But quickly, I want to talk about what are the triggers. Stress, either physical or mental stress. So the kind of physical exhaustion or physical tasks that other people that does not have sickle cell disorder can engage in is not the same for people that have sickle cell disorder. And so somebody that has sickle cell disorder that is involved in a particular form of sport may not be able to engage in more activity compared to others because those kind of stress can trigger the crisis, either physical or mental. Then infection, either bacterial, viral, parasitical infection can also trigger crisis. Even COVID-19, which is a viral infection, can trigger a sickle cell crisis. Dehydration can also trigger a sickle cell crisis. That is why it is important for people with sickle cell disorder to always take in more water. It is important we take in fluid more that is required for people that do not have sickle cell disorder. Also, extremes of temperature, cold or hot temperature. Now, for extremes of temperature, what is categorized as relatively cold for us that have sickle cell disorder may not be described as cold for those who don't have sickle cell disorder. So at times for me with sickle cell disorder, an environment that the AC is on may be too cold for me. And I will just choose to leave the room because if I continue exposing myself to it, it can trigger a crisis. So what is described as extremes of temperature for cold or hot may not be the same for normal people that do not have sickle cell disorder. Hypoxia, whereby when there is low oxygen in the body, can also trigger the crisis. And then acidosis, when there is increase in the acidic solvent of the body, can also trigger the crisis. So the next slide talks about the crisis of sickle cell disorder. There's hemolytic crisis. Hemolytic crisis occur when there is frequent breakdown of red blood cells. As my co-presenter has mentioned, the red blood cell for people with sickle cell disorder is sickled in shape. It's not normal. The normal shape of the red blood cell is biconcave or oval. But for those who have sickle cell disorder, certain conditions, which are the triggers of crisis, can make it become sickled in nature. And so these are the crises that occurs when the triggers causes it. Hemolytic crisis, when there's frequent breakdown of red blood cell. And there are two reasons for this. Because of the abnormal shape of the red blood cell, there is frequent breakdown. The body, especially the spleen, which is the major organ for immunity, identifies it as abnormal and destroys it. So there is frequent breakdown of the red blood cell. Now, the abnormal red blood cell, which is the sickled red blood cell, does not have the normal lifespan for the normal red blood cell. It has a shorter lifespan. The normal lifespan for the normal red blood cell, which is biconcave, is 120. But for somebody that has sickle cell disorder, the lifespan is shorter. It could be 20 or 30. So the frequent breakdown of the red blood cell and then the short lifespan of the red blood cell are the reasons that can often result to hemolytic crisis. Another crisis is the vaso-occlusive crisis or the pain crisis. This is the commonest, and this, most of the time, one of the first symptoms that somebody with sickle cell disorder can present with in the hospital, or it could be one of the first manifestations that the person could have and make he or she undergo tests to be able to identify that he or she has sickle cell disorder. And so quickly, let me try and describe how the pain crisis is like. From the video, you could hear that both the people that the two videos we saw, both the two people with sickle cell disorder mentioned pain. The pain crisis can be described as the pain that occurs in a woman with pregnant woman that is in labor when she's in active labor and she's about to deliver. The way the pain affects the woman, that is the exact way the pain is for people with sickle cell disorder. So at times you could see somebody with sickle cell disorder presenting the ER with pain, but not shouting or wailing like somebody that has having pregnancy and at time about to deliver in labor pain. And because of this makes health workers discriminate people with sickle cell disorder because they see you not shouting, not wailing, not being melodramatic because you're having pain. But that does not exclude the fact that the pain you're having is the same kind of pain that a woman that is in term labor is having, a woman with active labor that is already at term in her pregnancy. Another way to describe the pain is somebody that have an asthmatic attack, somebody that has asthma that have an asthmatic attack. For an asthmatic attack, there is chest tightness, there is pain in the chest, there is tightness in the chest, and then the person will be gasping for breath. That is the same way, and that's the same pattern we also experience the pain crisis. Also, for somebody that has a bone fracture, especially multiple bone fracture, the way the pain affects the person, that's the same way the pain crisis occurs for us with sickle cell disorder. So that calls for proper empathy. When you see somebody having sickle cell disorder presenting with a pain crisis, even if he or she is not dramatizing or shouting that he or she is in pain, understand at the back of your mind that the pain the person is having is the same kind of pain somebody is having multiple bone fracture or a woman pregnant that is at term and she's in active labor is having. Another crisis is sequestration crisis. That crisis occurs in the spleen. I mentioned earlier that the spleen is the major organ that is responsible for the immunity of the body, detects anything foreign or abnormal in the body and then kills it. So for people with sickle cell disorder, for those of us living with sickle cell disorder, because our red blood cells often get sickled, the spleen identifies it as abnormal, as foreign, and so mops it up from the blood, mops it up from the circulation. And when this continues frequently, it results to what we call sequestration crisis. There's pain in the spleen, and then the spleen gets enlarged through a process that we call splenomegaly. Megaly means enlargement. So the spleen gets enlarged. And after a while, the spleen suddenly gets shrunken in size. And for people with sickle cell disorder, once they have passed their childhood or adolescent period, and you are trying to palpate for the spleen, on the left side of the abdomen, at the upper part, close to the heart, you will discover that you will not be able to identify the spleen because that undergo a process called autosplenectomy, which is a fallout from a sequestration crisis. Another crisis is the aplastic crisis. Aplastic crisis is also called aplastic anemia, whereby all the blood cells are low or absent. The red blood cell, which is affected in sickle cell disorder, the white blood cell, which is like the soldier cells of the body, and then the platelet, which is like the police, all of them are reduced or they are absent, they are low. So every complication that can occur due to the problem with each of the red blood cells will occur with the aplastic crisis. Then there's also the acute chest syndrome. The person will present with shortness of breath, and the person could difficulty with breathing. The person could have cough. At times they could misdiagnose as pneumonia, but it's not pneumonia. So those are the crises that we know medically, but there could be more that occurs in people with sickle cell disorder. So the next slide, I want to talk about the complications of sickle cell disorder. And I want to also understand that sickle cell disorder affects somebody that has it right from birth till their entire life. So you will see the person having different complications as a result of sickle cell disorder. Why does it happen? Just picture at the back of your mind. Because the blood can flow to every part of the body. Once the sickled red blood cell blocks the circulation of blood in the blood vessels, it causes problem. So wherever this occurs, any part of the body, it can cause problem in that part of the body. The brain, the eyes, the leg, the spleen, the liver, any part of the body. So from childhood, you could see somebody with sickle cell disorder attaining puberty at a very late stage, while others could attain puberty from 15, 16 years old. People with sickle cell disorder will be having delayed puberty. I had delayed puberty, such that my younger brother was taller than me, and most people in my peers attained puberty before me. And so sometimes when we go out together with I go out together with my peer, and there is a age restriction to an event you're attending, I will be ostracized. I will be prevented from entering because I'm shorter than my peers, simply because sickle cell disorder causes delayed puberty and stunted growth. So another thing it causes is dactylitis, which we call underfoot syndrome. I had underfoot syndrome, I think, at the age of 6 years. The hand and the foot and the ankles are swollen, and they are very painful. And that was my first reason of hospitalization, because I presented to the hospital with it, and I was transfused with blood. So those are also complications of sickle cell disorder: dactylitis, hand and foot syndrome. For some children, this dactylitis could be the first manifestation that is detected by the parents, and then when they do some tests, they identify that, oh, this child has sickle cell disorder. Other complications, there is priapism. Priapism is purposeless, painful, persistent penile erection. The penis, the private organ of the man, becomes painful and becomes erected, but the erection is purposeless. It is not due to sexual arousal. I also had priapism. My first encounter of priapism was in my 5th year of medical school, and I went to go and read it up, and I discovered, oh, this is what I was having. And so I had it all through. And priapism can be, if it occurs for long, at most 3 or 4 hours or more, it can result to erectile dysfunction, impotency, and other problems. So those are one of the other complications that can occur due to sickle cell disorder. The blood circulation, the blood vessels within the penile organ is blocked because of the sickled red blood cell. And when it is blocked, it causes a painful, purposeless penile erection. Another complication is stroke, both in children and adults. While I was growing up and as a medical student, what I got to understand was the risks of stroke in people with sickle cell disorder, of course, in children. But recently, I think 2011, I did a CT scan and MRI of the head, and they discovered that I have silent stroke, which is, in other words, asymptomatic stroke. And when I reach out to other people with sickle cell disorder, I got to understand that not only is the risk of stroke in children with sickle cell disorder, but also adults with sickle cell disorder, there is a risk of stroke. So when the blood vessels supplying the brain are blocked because of the sickled red blood cell, it causes stroke. Also, kidney is affected, and then it could present with enuresis, nocturnal enuresis, bedwetting. I bedwet till at the age of 10 years. And you know, as a child bedwetting, the emotional trauma that comes with it, I tried different things at that period, and nothing worked. And so this could present, for some children, this could result to depression. So at every point in time when you're having some of these complications, it affects your mental capacity, it affects your mental status as an individual. For that age, I was bedwetting till the age of 10, and all my siblings stopped bedwetting at a very tender age. And so it was a big issue for me when I was growing up. So those are part of the complications of sickle cell disorder. Also, hypostenuria, renal papillary necrosis, and kidney failure. Once this blood circulation to the kidney becomes blocked, frequently it can result to kidney failure. Other problems is chronic leg ulcer. I had chronic leg ulcer twice, and then the ulcer on the wound on my leg existed for 6 months. Each episode occurred for 6 months. So you could see somebody having a wound in the leg that has refused to heal. Ideally, when there is a wound, medically you expect the wound to heal within the 3rd week or 1st month. But for people with sickle cell disorder, it can result to chronic leg ulcer whereby the wound will not heal and can persist for months or years. I've met other people with sickle cell disorder that had chronic leg ulcer for 7 years before it got healed finally. So I had chronic leg ulcer for twice, and each period it was for 6 months on the right leg ankle and on the left ankle. So, and the mental challenges that come with it also affected me. At the first instance that I had it, I was so tired because I kept dressing the wound and doing other forms of intervention, but the wound was not healing. And at a particular point, I thought maybe I would just need to amputate the leg. So those are part of the emotional trauma that can occur with people with sickle cell disorder when they have chronic leg ulcer. Also, there are different bone complications. There is osteomyelitis, which is infection of the bones. For people with sickle cell disorder, there is a high risk of osteomyelitis. There's also avascular necrosis, whereby the hip bone is eaten off, and then most people that have avascular necrosis often resort to a surgery called hip replacement, and some of them start using crutches or start using wheelchair. I think the person that we saw in the second video, that was using a crutch, is probably because of avascular necrosis. So avascular necrosis is also one of the bone complications due to sickle cell disorder. There's also spondylodegenerative changes of the vertebra. I also have this one. This was detected when I presented with persistent chronic lower back pain. So let us move on to the other slides because of time. I swear that my time is very short. The next slide. Other complications of sickle cell disorder, there is a stone within the gallbladder that is called gallstones. This was detected like last year in me, but the stones were very small, 6 millimeter. And for some people that becomes very horrible and becomes problematic, they will have to do surgical removal of the gallbladder. Also, there's retinopathy, problem of the eyes. So with sickle cell disorder, once the blood vessels supplying the eyes is affected, it can result to retinopathy and other eye problem. As I will say, because of limited research in sickle cell disorder, there are many conditions that we are coming to realize now that we are living, that we are adults, which medical science does not talk about. So don't be surprised. In the nearest future, we may discover other eye problems associated with sickle cell disorder beyond retinopathy. Also, in pregnancy, a woman that has sickle cell disorder is at risk of premature contractions, whereby she will start having labor pain at a very, we need the first trimester or the second trimester when she's not yet due to give birth. She could also be having preterm, she could also deliver preterm, whereby she delivers before 37th week of the pregnancy. She could also have preeclampsia or eclampsia. Those are other problems that are associated with sickle cell disorder in pregnancy. Also, the woman could also have anemia because of the frequent breakdown of the red blood cell. Then there's also another condition called chronic fatigue syndrome. Particularly with this is a condition that is not new, but is newly spoken about. WHO recently has been talking about post-COVID or long COVID. And I had COVID infection 2020, last year, 2022, in October. And when I had COVID infection, the same presentation, symptoms, and the same pattern was with this chronic fatigue syndrome. And I've been having this chronic fatigue syndrome for almost 7 years. And the symptoms are chronic fatigue. This chronic fatigue is peculiar. When you go to rest, you wake up and you feel weaker. And it's not because of the frequent breakdown of the red blood cell. With people with sickle cell disorder, because of the frequent breakdown of red blood cell, we can have fatigue. But this chronic fatigue that according to chronic fatigue syndrome is not because of this. I've been having this chronic fatigue for a long time, and at times I get to do get to check my blood, my hemoglobin specifically, and it is normal for my genotype, 11, 10, and yet I'll be having the chronic fatigue for weeks. So it's not because of the breakdown or the low red blood cell. It's just due to a particular condition called chronic fatigue syndrome. However, sickle cell disorder is not the only causes of chronic fatigue syndrome. COVID-19 has been shown to cause it, HIV, cancer, and many other conditions, but it's not well spoken of, or it's not frequently spoken of. And so there's limited information in the medical space or the public health space regarding chronic fatigue syndrome. It's also present with unrefreshing sleep. No matter how long you spend sleeping, you will wake up unrefreshed and tired. Also presents with migraine-like headache, whereby the person will be having headache as if it's migraine. Then it also causes loss of memory, short loss of memory. I also have this, that at times, whatever you tell me in the next 5 or 10 minutes, I will just forget it. And when I've spoken with some people that have sickle cell disorder or COVID-19, they've also been able to identify having this short loss of memory. Some people could be having loss of concentration. It also causes myalgia and other symptoms as well that we are discovering. So chronic fatigue syndrome is it's not a new discovery with sickle cell disorder, but it's something that is newly spoken about. And many people with sickle cell disorder have had it, but because people are not listening to them, the community is not listening to us, the medical community is not listening to us, few people have been able to speak about it, and they kept quiet talking about it. So it is now that more people are getting to talk about it because it is a horrible condition. Then another problem is also epistaxis, whereby there is sudden profuse bleeding in the nose. I also had this during my adolescent life. Then another condition, another complication that sickle cell disorder can cause is pica. Pica is when you are eating inordinate objects. I was eating chalk and sand. Until 18 years, I was eating sand till I finally stopped. I just said God delivered me. So I've had other people with sickle cell disorder that said they were eating foam. Some people said they were eating ashes, charcoal. So pica is another problem that sickle cell disorder causes. And I believe there's more research needs to be done to be able to unearth why pica is associated with sickle cell disorder and how to manage it. Also, there are a lot of mental health problems, depression. I started treatment on depression 2019. And so because of the frequent breakdown, frequent pain crisis and other crises we have, there's a risk of having depression. There's a risk of having anxiety, memory loss, and suicidal thoughts. And also, it could also affect our intellectual property, intellectual processing, intellectual capacity. Also, there could be sleep disturbances. Sickle cell disorder can affect your sleep and this causes some insomnia, or it can also cause somnolence, whereby the pattern of sleep is disrupted. And it could be due to many factors. One, it could be also as a side effect of the medications, especially the opioid and non-opioid medications we use for the pain in sickle cell disorder. Chronic fatigue syndrome can also cause unrefreshing sleep, which is also a sleep problem. So those are some of the complications that I can mention for now because of limited time concerning that sickle cell disorder causes. So let us move to the next slide so that I can hand over to my co-presenter. The next slide.
Okay, Dr. David, we have about 2 more minutes.
Okay, so thank you very much.
One of the things I wanted, before we wanted to give an opportunity to everyone to ask us some questions, but I also wanted to do a call out to young people and everyone who's listening that really in the United States there is a bill before Congress right now. It's called the Sickle Cell Disease Comprehensive Care Act. It's bipartisan, meaning both sides of the table in the United States, the Democrats and the Republicans are supporting this act. And I would like, I know we're going to have the United Nations Association will have a day at the Capitol, but really this is a very important act for sickle cell disease. What it does is it allows for Medicaid, which is our social health support health care for individuals who cannot afford a medical coverage on their own. They will now be able to go into hospitals, go into centers, and receive care. The other thing is there are a lot of centers that are not available. They are in, right now, the centers I showed you the table, but most of them are in privileged areas. But when we talk about people who are in poverty and need, those centers don't exist. So this act is to, one, create more healthcare centers for sickle cell disease, and also allow for Medicare to be available for sickle cell warriors and their families. So I think that was our next to last slide. And then there's one other call out that we wanted to make a shout out. One of the things that we found in the United States, and one of the things that we found in all countries, is there are a lot of young people who have now left their homes at the age of 18 to 25. We call them in the United States emancipated youth. Those young people have no access to health care, but they may be sickle cell warriors. I and my family have seen one or two of those warriors die at the early age of 30 or in their 30s as a result of not being able to have access to care. We are the United States. We should have better health care and access, and not just the United States, but throughout the country, all countries globally. Dr. David and I are working on a campaign to create healthcare access for families who don't have access and need it. And we want to start as a beta test in Nigeria, but we want to expand it across the globe to all of those areas that have individuals who cannot afford care, but who are what I'll call sickle cell disease warriors, people with sickle cell disease, and their families who need support. So we ask if you know of any individuals who are between the ages of 18 and 25 with the sickle cell disease, no matter where they are, whether in the United States or globally, please contact us. We'd like to know about them and support them. And also any emancipated youth groups. who can allow us to talk to these individuals so that we can provide better access to healthcare for sickle cell disease. And with that said, I think we'd like to open it up for questions, if there are some. We'll probably still have a little bit of time to take some questions.
Yes, we have 5 minutes.
Okay. I'm trying to look in the chat. If you could just bear with me for a minute, I cannot see it on my screen. So I'm trying to see if anyone put questions. Please put your questions in the chat, and then we'll pick them up on the chat and answer them. Okay. Thank you.
Thank you.
A little bit of technical assistance here. Let me see. Dr. David, can you see some of the questions in the chat as well?
No, I can't see them yet.
Okay. Well, let me go to the top because there's quite a few. Just bear with me. Wow.
Oh,
Thank
okay,
you. Thank you for participating. You can see them? Okay.
Yeah.
Okay. I see someone from Chad Republic, and I thank you for being on with us and listening to the presentation. I see someone from Yemen. Thank you for being on with us and watching. Someone from Bangladesh, someone from Nigeria. I'm looking for any particular questions, but I want to acknowledge the different countries that are here and the people from different areas that have been listening to us, Dr. David. There's someone from Sierra Leone. Greetings from Bangladesh again. Attending from Cameroon. Greetings from the Congo. And then we also see attendance link for, let's see, from Afghanistan. Thank you for attending as well. I'm still searching, and from India. Thank you for attending. I hope we've represented all of you very well. And welcome. I just see attendance links. Hi, I'm Chad from Tomai. Greetings from Pakistan again. Esther Lee watching from Liberia. Again, watching from Nigeria, Pakistan, India. Wow, I'm so proud of the audience for staying with us and listening to our presentation. Please let us know if you have any questions as I go through the chat. And I have someone saying, I'm proud to be a part of this experience. Thank you for attending. Nigeria, I'm glad to be here. Thank you for attending. Watching live from Sierra Leone. I see a lot of thumbs up. Thank you. Some people. I'm sorry?
I think I've seen a question from Nidam Samuel Dash from
Okay.
Nigeria.
Would you like to speak it out loud?
Okay, it says, do the white blood cells in an AC victim carries it? No, it doesn't. It is not the white blood cell that is affected for sickle cell disorder. It is the red blood cell. The different types of blood cells, white blood cells, red blood cells, platelets. It is the red blood cells that is affected, not the white blood cells. Okay, you can continue, Lenora.
I'm searching for questions. I just see people saying hello. So I'm just acknowledging them from Ethiopia. Thank you for attending. Zambia, thank you for attending. Greetings again from Nigeria. It's a really informative section for me because I am a medical student. Oh, great. I'm glad you're here. And if you want a copy of our slides, please let us know. Watching from Nigeria, lots of thumbs up and peace signs, and it's a really informative session. Greetings from Pakistan again. I'm looking for questions. Dr. David, you can always chime in if you see questions before me because there's a lot of chats here. Okay, great to learn about sickle cell disease. Good information, concise and well articulated. All new information for me, so thank you, Lenora. Oh, you're welcome. Following me from Republic of Chad. Okay, thank you and welcome. Informative session is in progress. Thank you. Impressive. Thank you. Information by the speaker, Ms. Lenore Williams, about the sickle cell disease. I learned a lot about the disease. God bless everyone with good health. God bless you as well. Thank you. The echo decreases the quality of sound. Oh, a tech issue. Thanks for taking such an intersectional approach. You're welcome. Any questions you can find, Dr. David? I'm just reading comments.
I think I've seen a question in the comment from
You want to read
Edward.
it and answer? Okay.
It says, if you don't have a trace of sickle cell, is it possible for a baby to contract it? No. If the parents don't have the trait, in other words, their genotype, blood genotype, or hemoglobin genotype is A and no C or S, the child cannot have it, or the child cannot inherit it. So it is only when the parent, one or both parents have it, that is when the child can inherit it, either a sickle cell trait or sickle cell anemia. Thank you.
Please stop me when it's our time. Okay. I'm going to wind up. We're going to wind up. Dr. David, do you have any final words for everyone?
Okay, just quickly, that we have sickle cell disease does not mean we are misfit or we cannot give our parts to contribute our part to the community and to the world. So I just want to say, give everybody a chance, give them equal opportunity. There is a lot of myths, misconception, and misinformation about sickle cell that causes discrimination. So please let us try and create better awareness to eradicate some of these myths, misconceptions, and misinformation. Thank you very much.
I would just have one closing word, if I could. Please advocate, 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 and know that it's important that we're a village. We can't do this alone. We need your support. So anything you can do to help us and advocate for these individuals, it would be well appreciated. Thank you so much for being a part of this, and thank you so much for having us and having the opportunity to speak about sickle cell disease.